My name is Strayhorn. I am an obstetrician gynecologist here in Elizabeth City, employed with Coastal Women's Center. I am also affiliated with Albemarle Hospital.
My name is Robert Holt, and I am a board-certified gynecologist, and I practice at Coastal Women's Center, and we're affiliated with Albemarle Hospital and perform a wide range of gynecologic procedures here.
A hysterectomy is a surgical procedure where the female's uterus is removed. Someone considering a hysterectomy should be counseled by her physician about the many options of treatment. Hysterectomy is a permanent treatment.
It should start with a thorough examination and a visit with her gynecologist. There are numerous reasons that would lead to a patient needing a hysterectomy, such as heavy or prolonged vaginal bleeding, uterine fibroids, which are benign tumors that about 40% of women get on the uterus, chronic pelvic pain from conditions such as endometriosis, pelvic organ prolapse, where the uterus can actually drop into the vagina over time. There are multiple types of hysterectomies that can be done. There is an abdominal hysterectomy, where an incision is made in the patient's abdomen to gain access to the uterus. There is a vaginal hysterectomy, where the uterus is removed through the vagina with no incisions on the abdomen. And then there are two types of what we call minimally invasive hysterectomies, where 3 or 4 small incisions are made in the abdomen and the entire uterus is removed in that aspect. And the two types of minimally invasive hysterectomies would be a laparoscopic hysterectomy or a robotic-assisted hysterectomy.
Following a total hysterectomy where the uterus and the cervix has been removed and the patient does not have a history of abnormal pap smear, she no longer requires pap smears. A patient that maintains her cervix following a hysterectomy, which would be considered a supracervical hysterectomy, she is still required to have her pap smears.
Recuperation time after laparoscopic hysterectomy, patients can normally go back to work within 1 to 2 weeks, providing they're not doing any heavy lifting or strenuous activities. Typically, we tell patients about 6 weeks before they're really able to undertake a strenuous exercise program. Albemarle Hospital is committed to providing the highest standard of care to our patients. I think we, as physicians, are committed to using the most recent technology that has the best proven efficacy and best long-range outcomes for our surgical patients.